Hello, my name's Dr. Michael McBride. I'm the Chief Medical Officer for Northern Ireland, and I'm delighted to have the opportunity to speak to you today about some of the tremendous local and regional quality improvement work that's going on across the health service on a day and daily basis. Now, quality means different things to different people. To me, it means about access to care in a timely way. To me, it means about an outcome of care and an experience of health care that is consistent and that is of high quality, and something that we can all be proud of, and something that we would wish for our own families. I'm delighted to be able to share just some local examples today of some of that quality improvement work that's going on within the context of our policy framework Quality 2020. Our challenge now is to join the dots and to ensure that that quality improvement work is embedded in the transformation of health and social care under Delivering Together.
Hi, my name is Mike Morrow. I'm the current chair of the Northern Ireland Simulation and Human Factors Network. And this is our third annual conference now, which is a fantastic result. Much of the work we've been doing was driven by the original Quality 2020 initiative. And I think the network, if today is anything to go by, has succeeded in that aspiration.
Hello, my name is Caroline Lee and I sit on the network with Mike. It has done fantastic work around introducing simulation and human factors. We've ran a number of programmes already, and they have been delivered to an interprofessional audience by an interprofessional team, and we think we have the right infrastructure around us to move forward very positively in the future.
We are developing a regional quality improvement innovation approach for health and social care in Northern Ireland. We are building on the work of the Quality 2020 strategy, the significant work that has been led by the Safety Forum and support from members of the Q community. One of the key messages people have told us about quality improvement is that it is not always visible to them, so as part of our work we've developed the HSCQI website to share improvement and innovation.
And our web address is qi.hscni.net.
My name is Mark Roberts. I'm the Clinical Director for the Safety Forum in Northern Ireland. What quality means to me is keeping things as simple as possible and trying to do them as well as you possibly can. When it's more complex, whether I'm a doctor in front of a patient or whether we're running regional collaboratives and improvement work, and I like us to try and keep an eye on the important big issues whilst not losing sight of the important detail.
Hello, my name is Denise Boulder and I'm the Midwife Consultant in the Public Health Agency, and I work very closely with the Safety Forum in the Maternity Quality Improvement Collaborative. The Maternity Collaborative works across all of Northern Ireland and across all of the professions involved in maternity care, and helps to join the dots between the strategic maternity strategy, planning and the clinical staff that are involved in maternity care.
Hi, my name's Helen Weird, lead midwife in the Antrim Hospital, and I want to talk about two pieces of work that we have done regionally with the collaborative. One is the obstetric early warning chart, which is a tool that midwives and doctors both use to help detect a deteriorating patient. These are really useful tools and actually help improve the quality of the service we provide to our mummies and babies. The second piece of work we've also worked on is the sepsis tool. This again was a great initiative regionally. All midwives and doctors within the region know about the tool, know how to utilise it, and means that we are dealing with sepsis in a very timely fashion, which improves the outcomes of our mothers and babies.
I'm Anne Campbell, catering manager here in the Royal Victoria Hospital. We cater for 1,200 patients each day, and we work closely with the dietetic department in sorting out our menus, and helps us really to deliver a nutritional diet on a daily basis.
Hello, my name's Siobhan McIntyre. I work in the Public Health Agency and I'm based in their Western office. I'm going to talk a wee bit about some of the work we're doing around workforce, and very specifically talking about improving the quality and experience of care for our users. And one of the things we've particularly done with the Western Trust pilot and an All-Ireland Collaborative, which has been established to review and enhance some of the care provision in areas where we have very high complex patients with very specific needs. And ultimately the bottom line is around improving patient safety. So what we're hoping to do is reduce bank and agency spend, reduce incidents on the ward, and improve the quality of the therapeutic interventions for patients like those with dementia on our medical and older people's wards.
My name's Helen Thornton. I'm the Community Connector for Lisnally Day Centre in Armagh. My role is entailed through the 10,000 Voices project from the Southern Trust. So I draw up a monthly newsletter for the service users within Lisnally to give them information about local community events and activities for days that they are not attending the Day Centre. It's very beneficial to them and they seem to really enjoy it. And I'll pass you over to Martin.
Hello, my name's Martin McWilliams. I'm the Community Connector here at Katy Day Centre. We've recently introduced a new physical programme called Moving More Often. It helps promote the physical and mental well-being within the clients within Katy Day Centre.
My name is Mrs. McGrath. I've been coming 23 years to the daycare here. I would do a lot of activities, our chair exercise, and I enjoy every minute of it.
And when we see the clients smile and be happy, it's a job well done by all the staff here at Katy Day Centre.
Hello, I'm Johnny Bailey and I'm one of the doctors in the City Hospital, and we have been involved in some quality improvement work, especially with regards to the care of older adults at the end of life, and we've been trying to make sure our patients who are approaching the end of life have access to the medicines to keep them comfortable.
Hi, I'm Kieran McKenna, Clinical Improvement Lead with the Northern Ireland Ambulance Service, and over the last year we have introduced a new clinical support desk within ambulance control, really built on the ethos of right care, right place, right time. The clinical support desk is staffed by 10 specially trained paramedics, and their role is to take secondary triage of all emergency calls to the ambulance service, and they can decide whether a person needs an emergency ambulance to attend hospital, or actually whether we can deliver care in the community using acute or enhanced care at home teams, falls teams, district nurses, or actually sending the patient to a more appropriate destination such as a minor injury unit.
Hello, my name is Mary McElroy and I am the Quality, Patient Safety and Patient Experience Lead for Nursing for the Public Health Agency. I chair the Pressure Ulcerative Group, and it's very much a collaborative approach with a multidisciplinary group of people. Today we are having an event to celebrate really what we've done to date, and also to learn from each other, and all of the trusts are represented. And in addition to that, we have a keynote speaker who's going to deal with repositioning and the importance of repositioning.
What we do is we educate staff, we look to make changes to how we deliver our care, and it's really ultimately all about patient safety and improvements in our standards.
Hello, my name's Michael McCready. I'm a porter in the Cancer Centre in the Radiotherapy Department. We bring patients down for radiotherapy treatment every day. These patients may be here for 6 or 7 weeks, so we do build up a good rapport with the patients, and we find patients like to have a bit of a laugh with us, and they do sort of confide in us quite a lot.
My name's Mary-Louise Sloan. I'm a Principal Social Worker in South Eastern Trust in the Safeguarding Children Service. We've been working on a few projects using a quality improvement approach. We looked at our current procedures and we felt that the current paperwork was not child friendly. So we co-designed a framework identifying areas that matter to children and staff. By introducing this framework on a consistent basis, 94% of children are reporting they feel listened to and involved and are clear about their safety plan.
Hi, I'm Dr. Karen Walsh. I'm a GP partner in Grosvenor Road Surgery in West Belfast. We have been doing quality improvement for the last 18 months. For us, quality improvement is a continuous journey. We use quite a lot of process mapping in order to map the patient's journey, making our care as patient-centred as possible. But for us, it's about more than that. It's about team. We meet together as a team on a weekly basis doing process maps, making sure that every member of the team has a voice that's heard, a voice that is involved in change and quality improvement.
As you've heard, quality isn't a place, it isn't a destination, it's a journey, a continuous journey of quality improvement. So come with us on that journey and let's make Northern Ireland a place where people look to as an exemplar in the delivery of quality health and social care services.